Good afternoon. My name is Ron Leibowitz, president of Brandeis University. My wife Jessica and I are delighted to welcome you to today's program. The past year, living through COVID-19 has underscored, among many things, the importance of scientific research in fighting the pandemic. In fact, at Brandeis, we recently granted the Louis S. Rosenthal Award for distinguished work in basic medical research to two scientists, Catalin Carrico and Drew Weissman, the latter a Brandeis alumnus, for pioneering much of the science underlying two of the COVID-19 vaccines now being given across the globe. But the focus of today's forum is not on the research being conducted by so many scientists and physicians to fight threats to public health, but on the urgent challenge of explaining science to the public and the role of the news media in the fight against the pandemic. The discussion will be moderated today by Neil Swidey, director of the Brandeis Journalism Program and editor-at-large of the Boston Globe magazine. Neil will introduce our panelists momentarily, but first I'd like to extend a warm Brandeis welcome to Dr. Atul Gawandi and Dr. Elizabeth Rosenthal, as well as a warm welcome back to Dr. Anthony Fauci, who participated in the recent Rosenthal Award ceremony. And so now let me turn the program over to Neil.
Thanks so much, Ron, and welcome to everyone. You know, I came to Brandeis in the fall with the goal of working with a small team to reimagine the journalism program. And we've added some great new courses and people, but we see a big part of our role as convening really smart people to try to tackle some of the urgent problems facing the news media in our democracy. And I can think of no better collection of talent and brain power to kick off this effort than the panel we have convened for you here today. I'll keep the introductions brief. Our panelists are so accomplished that reading all of their accomplishments would eat up the whole hour. But I'll just start with Dr. Anthony Fauci is director of the National Institute of Allergy and Infectious Diseases and chief medical advisor on COVID-19 to President Biden. He's also, of course, widely trusted and now incredibly popular and has the singular distinction of having been portrayed on Saturday Night Live by both Kate McKinnon and Brad Pitt. Welcome, Dr. Fauci. Dr. Atul Gawandi is a surgeon at Brigham and Women's Hospital, a Harvard professor at both the med and public health schools, a New Yorker staff writer, and a best-selling author. He's also the founder of Ariadne Labs and co-founder of CIC Health, which is a major player in the mass vaccination sites going on now. And for all you researchers out there who are doing those studies showing how lousy we human beings really are at multitasking, you've got to deal with the one-man rebuttal in Atul. Welcome, Atul. Dr. Elizabeth Rosenthal is the editor-in-chief of Kaiser Health News and a contributing op-ed columnist to the New York Times. During her years as a reporter for the Times, she was in the Beijing bureau where she covered SARS and the avian flu. She's also the best-selling author of a really important book, American Sickness. And she began her career as an emergency room physician, which prepared her perfectly for a life in a frantic, coffee-fueled, sleep-deprived newsroom. Welcome to all of you. I'm enormously grateful for you for sharing your insights and time today. Like everyone else in the audience, I'm eager to hear you talk. So once we get things started, I'm going to try to stay out of the way as much as possible. Just one word to the audience about questions. We have the Q&A function open. So if you have questions, please add those. We'll be monitoring that during our time. We also got a ton of great questions when people registered. We have very limited time here today, particularly for Dr. Fauci, who is going to need to leave a few minutes early. So we'll do our best to get to a representative sampling of the questions, but please bear with us on that. And now let's get started. So Dr. Fauci, we're a year into this pandemic, and I'm just wondering what you feel are the most important lessons that you've drawn from our response, both from the public health officials and the journalism side, that could help us do better the next time around or do better to get out of this more quickly?
Well, I mean, there are several lessons, Neil. The one that I think is the most cogent that I've had to experience up close and difficult is that if ever you want to have a historic pandemic, don't have it at a time when there's intense divisiveness in society, which is what we really went through, where as difficult as much as a response to a historic pandemic is, it becomes extraordinarily problematic when you try to guide the country through difficult public health measures that have implications well beyond health, namely on the economy and on indirect effects on people's lives. At the same time, you're trying to blunt the surgence of what is clearly already shown to be historic in its dimensions, with 515,000 deaths already, at the same time that you're almost fighting a political battle with half the country about trying to get public health measures implemented. So to me, that's a lesson that if you're going to fight a pandemic, it's got to be the entire country pulling together. You have to respect differences in states and differences in regions. That's one of the beauties of our country, the diversity that we have geographically, demographically, et cetera. But when you have a situation where there are individual elements of it doing things that are directly contrary to public health measures, it becomes very, very difficult. The other thing, just to be brief, is that don't ever underestimate a microbe that has emerged. One underestimated early on HIV in the very early years, few gay men getting infected, probably a fluke, probably something that's going to just be an aberrancy to one of the most extraordinary outbreaks of an infectious disease we've had. We're still in the middle of it. And in the beginning of the outbreak here, fearing but never really wanting to believe that it could turn into such an explosive outbreak as it did right now. So there are many other lessons, but those are two of the ones that stick very much with me.
That's great. Dr. Gawande, how about you?
I think I'd add to that, one of the things that taught, especially thinking about my hat as a journalist, is about the limitations of science journalism. We've been impotent, I think, in addressing the strengthening forces of pseudoscience and anti-science. And most of our approaches to it, which amounts to thinking that fact-checking will prevail, have not succeeded. It's been made more dangerous by the force that Tony mentions, which is the alliance between political power in an election year and pseudoscience in the midst of a pandemic. I was really struck just this week by the CPAC, the conservative meeting of the major Republican figures, that the most celebrated political figures for the next president, beyond President Trump, DeSantis and Noem, all are there because they've made a point of defying the public health scientists, and that they have made a point of specifically attacking Tony. And the reaction after that, to immediately follow it by the governor of Texas and Minnesota and Mississippi, jumping to make sure they're recognized to be seizing the same banner of 100% reopening, ending mask requirements, and saying that, we will defy the public health scientists, really is a quandary for, what science journalism is, how it addresses the issue, other than throwing hands up in the air and saying, how can it be? Of course, science is science. And I think it's exposed our impotence, I think, against a major force.
Dr. Rosenthal?
I'd like to stand up for journalism a little bit on this one.
Good, you can come in and defend.
I mean, it's really hard to do good journalism when the information coming from the government, the CDC, the FDA, is so limited and constrained, right? So we were constantly over the past year digging to find things where I was saying, like, why is it our job to figure out how many healthcare workers have died of COVID after on-the-job exposure? Doesn't the CDC or OSHA collect that? But no, we did. We did a fabulous series called Lost in the Frontline. And, and that has certainly gotten better with the new administration. We're starting to get a much better flow of information to help guide or contribute to the science journalism. But we were it's very hard to do journalism when, frankly, the president is the one spreading misinformation. And I'm sure no one knows that kind of quandary better than Dr. Fauci. Beyond that, I would say one thing we've really learned from where I sit is that, many of us journalists are kind of, how do I put this? We're kind of snobs. Like all my reporters, they want to write for the New York Times and the Washington Post and, PBS, the New Yorker. We do a lot of things. We've really shifted our strategy to go to small newspapers and small markets because that, and talk radio, because that's where people are getting their information. So I think part of this is thinking about the function of journalism differently. If you want to counteract misinformation, you got to go to where the misinformation is coming from. You can't, like I do, write op-eds in the New York Times. Yeah, that's fine, but most of the people who read the New York Times already know that COVID is real and that we have to wear masks. And, I like to point out things that I think we don't all know in those opinion columns. But I think part of the problem was the coming together of pandemic at a time when local journalism, there are news deserts all over the country where the only thing to fill those deserts was often social media. And that was a disastrous combination in terms of getting good information about how to respond to COVID out there.
I want to dig into that. There's a great insight a little bit more. Dr. Fauci, this is the first major public health crisis that we've had to fight when more than half of our Americans are getting their news from social media. And as Dr. Rosenthal said, in many cases, solely through social media. So I'm wondering how you had to pivot and adjust, and if you think we did, from the public health side, enough adjustment to deal with that new reality. And I also want to ask just one more thing. A good friend of mine said, our biggest issue right now is we have a problem of underbelievers and overbelievers. We know about the underbelievers. These are the people who dismiss science for political reasons, as Dr. Gawandi was saying, or because they don't want more inconvenience in their life, and it's a good excuse for that. But the overbelievers has to do with science journalists in some cases like that, and that's people who treat information coming from scientists or medical officials as certainty, when we all know that it's always changing. And I think we saw that play out last year with the face mask issue, with the Surgeon General saying, don't buy face masks. They're not going to stop the fight of COVID. And now the number one reason that science deniers use to support conspiracy theories about the government is the early flip-flop from the government on face masks. So how do you see that overbeliever, underbeliever issue? And if so, what do we do about it?
Well, I'm not so sure. I mean, when Atul was talking about impotence of journalism, I was going to say, join the club, Atul. Impotence of trying to communicate when you have the underbelievers. It's the false equivalency. That's one of the real issues that's a problem, where you have one group saying one thing, the other group saying the other thing. There's no judge or editorialization there. There's no shame in being wrong. And it really becomes just almost a circus. It becomes very, very difficult. I mean, you're absolutely right. You point out that issue with masks. At the time that we were saying that we really shouldn't be using masks, the circumstances had three aspects to it that were important. One it was felt that there was a shortage of masks, and that if you did go out and everybody started buying masks, there wouldn't be enough masks because there was a time of acute shortage of PPDs, and we didn't want our healthcare providers, of which I am one, and of which Elizabeth was one, and of which Atul does every day. You didn't want them to be essentially out of PPEs. The next thing is that there was no good meta-analysis showing that they actually worked on the outside of the operating room or outside of a healthcare setting. And number three, we didn't have a really good idea that a substantial proportion of the infections were spread by people who had no symptoms. So that was when that the Surgeon General was saying, and we were echoing his words about, don't get so excited about wearing a mask. Then what happened? It became clear that cloth masks works and you could make them by the billions. So that took care of that. Number two, meta-analysis studies started to show that in fact, they do work, both in preventing you from infecting others and others from infecting you. And probably the most important thing, we found out that between 50 and 60% of the infections are transmitted by someone who has no symptoms. So you could have somebody walking around thinking they're fine, spreading infection. Yet, you're absolutely right. That became the calling card of don't listen to anything any of them say because they're wrong. I mean, that was the governor of South Dakota's mantra this weekend, saying they're wrong, therefore I'm going to do all these things. It becomes an almost impossible thing to counter, which is why I thought of it immediately when Atul said the impotence of journalism. I mean, the impotence of the scientific community to counter something when they throw something like that in your face. It is one of the most painful things that I've gone through over this past year.
Dr. Rosenthal, you were in China, as you said, when SARS was happening. We know Asia, that was the centerpiece of their response to respiratory viruses. Do you think science journalists enough of them called to question that when that first guidance was coming out?
About the masks, you mean?
Yeah.
No, I think, I hate it being called a flip-flop when it's in fact, as Dr. Fauci said, it's a product of learning. It's not a flip-flop. It's progress. We understand something more now. SARS was a very different illness. I mean, partly because there was no transparency on what was going on. You would just see ambulances and be told that there were very few people dying when you knew the hospitals were filled and you knew people who were quite sick. And it was somewhat less transmissible, we know now, but not a whole lot less transmissible, but it wasn't transmitted by asymptomatic people. I think because the feeling is that the people who got it, and the real doctors here can probably correct this, they were really sick. I mean, a very high percent of people who got SARS died. So, I felt like, and I've written about this, that I lived through this kind of lockdown experience with my kids. And, but it was quite different. But it does annoy me when my friends from New York always say, oh, well, SARS isn't like COVID. This is different. This is way worse here. And I'm like, well, yes and no. SARS didn't come to New York because at that time it was very hard for Chinese to get visas to come to the US, and because most people who had SARS were too sick to get on a plane. So I think it was just, different virus, different characteristics. And you learn about those things as you go along. So in one of my early columns, I too wrote something about, because I listened to what Dr. Fauci and the experts say, you don't really have to do this mask thing. But then we learned very quickly that we did and shifted, and that's appropriate. And I think one of the things that I applaud the new administration for, and Dr. Walensky and Dr. Fauci and President Biden, is for saying we're going to tell you what we don't know, which the previous administration was kind of loath to do. There was a kind of false confidence about things that we really didn't know.
Dr. Gawandi, what do we do about this impotence that you described?
Well, first of all, to dive a little deeper into it, part of the interesting thing is that I think science journalism, at the same time I described it as impotent, saved lives. And did because there was a large portion of the world that was listening. Maybe it was 50%, maybe it was 60%, maybe it was 70%, who took in the information and changed their behavior accordingly. It was very interesting to me early in the pandemic. You had states like Massachusetts that restricted spaces and suggested people wear masks, and that in Florida, where that didn't happen, you had the same rate of uptake among especially the older population. So they stopped going out to the movies, they stopped going to restaurants and bars at the same rate that people in Massachusetts did without the rules in the government. And the reason why is because the information got around. Where the impotence comes up is in the 30 or 40%, where early on, it's not just in the United States, in countries where I think that part of the issue here lies in two things. One is that the asymptomatic transmission, you don't have to, you don't feel anything, and yet you are passing it along. And that compounded the fact that 75% of the transmission is from people between the ages of 20 to 49, and 93% of the deaths are in people over 55. And the folks over 55 have been the ones to listen to the advice, and that's why I think it saved lives. And yet it didn't stop transmission, because as in many countries, there have been leaders who can exploit those who you can say it's no big deal, and those people are not feeling anything, and they're not the ones to necessarily get sick, but their freedom is their lives are being curtailed in significant ways, and their pain isn't necessarily being acknowledged by everybody, that their lives have changed, their kids aren't in school, those kinds of things. How do we overcome it? I've had a theory, I don't know how it'll play out, but that we can do a better job in science journalism and as public health leaders in pointing out how you come to recognize the difference between good science and pseudoscience. There's a pattern that people have pointed out. The hallmark moves of pseudoscience is declaring that there's a conspiracy to suppress dissenting views, putting on fake experts with contrary views but no credible scientific track record in the field, cherry picking data to discredit a field, and deploying logical fallacies. Some of those things, there are occasionally conspiracies. We had Tuskegee. There are experts out of left field who can make discoveries. But when you put them together, when you see that pattern, that's when you know you're being fed the goods, right? And I wonder whether by learning how to indicate to people, this is when you know, whether it's from the left, whether it's from the right, whether it's a politician you like, whether a politician you don't like, whether they're actually, using science as a way of making claims. And I think it's possible to say, look, this is how you know you're getting snookered, and have a debate about that as part of the discussion. It may still not be strong enough.
Yeah. Dr. Fauci, we also have this other issue that we're grappling with right now this week, when we're seeing what's happening in Texas and Mississippi, and that is maybe an American tendency to want to celebrate and exhale too easily when we start to see signs improving, maybe others exploiting it for the reason. What do we do with that, and what role can journalism play in that progress of not letting us undercut when we're starting to move the stats in the right direction?
Yeah, I want to link that to something that Atul just said about the contrast between what happened in Massachusetts and in Florida, where the elderly individuals really understood that they really needed to be careful. I think that right now the press should really come out strong about how, I don't want to use too strong a word, but how ill-advised it is right now If you look at the curve that was steeply coming down, the last week, the 7-day average, it's done this. That's exactly what happened last summer when we tried to so-called open up the economy again, and several of the states did a version of what Texas and Mississippi are doing now, and we had it go right back up. The baseline that we're at right now, between 60 and 70,000 cases a day, is unacceptably high for any significant pulling back on mitigation. And I think we just need to state that. You sort of have a tendency, you don't want to directly contradict someone in such a position as a governor, but the fact is that is ill-advised. And when we say that, hopefully the people who are the most vulnerable in Texas and in Mississippi will essentially, shield themselves to the extent that they can. But as Atul said, it's the younger people who are not getting sick that are spreading it. It's a very unusual infection where you have the people who spread it are the ones who are least likely to be impacted by it. I've never quite seen an infection like that.
I
Dr.
wanted
Rosenthal?
I wanted to ask, because this is the journalist's dilemma as running a newsroom on a daily basis. We have written numerous articles now stating several things. One, that even if you've been vaccinated, you still need to wear a mask because you could still potentially spread it. That even if the rates are going down, you still need to wear a mask, or even more, because to maintain that we shouldn't. It's premature to open. I think Dr. Walensky is very powerful in how emotional she gets about this on camera. But our dilemma is you can't run the same story every day. It becomes like oh yeah, there they go again. So how to make it real to people? And one of the things that we found very effective, and for the audience, is always to put this in human terms, because one thing I think we've seen across the country is initially, like it was in New York, it was in the Pacific Northwest, and people thought, oh yeah, that's in New York, that will never come here. And of course, viruses don't respect those boundaries, and it did go everywhere. So we've tried to make sure that we're featuring the stories of people that a reader in that demographic can relate to. I think one of the most powerful things I've heard, and I'm going to toot our own horn here, but we did a podcast with Reveal over the weekend following a young Latina intern at a hospital, a critical access hospital in the Central Valley, through her first 7 months of internship during COVID, where her parents got COVID. All of her patients had COVID. Many of them couldn't speak English. Many of them couldn't see their families. She was the last person to hear their dying words. And this she was an amazing young woman. At the end of it, the reporter says, well, do you consider yourself a hero? And she was like, no, I'm not a hero. I'm just doing my job. But that's why it's so important for everyone in these communities to put on a mask. And that's their version of being a hero, or not going to a restaurant, even if you really, really are dying to right now. So I think it's speaking to people, not as, I can give you statistics about the number of, Black and brown people, how it disproportionately affects certain communities and certain essential workers, but to make those stories human, so people, because what people respond to in journalism is hearing a story about someone like them who got sick, or who, when it came to a community that could be their uncle or their cousin. And I think that's where journalism has kind of fallen short in some areas, because at a high level, we think, oh yeah, people will respond to these alarming statistics, and numbers are numbers to most people. They don't feel personal.
Dr. Gawandi, do you have questions you want to dive into?
Yeah, I'm curious to ask Tony about some of the people that are most heroic to me are the public health officials in the counties and cities where the pullbacks are happening, and they are fighting the fight. They're trying to bring facts. They're the ones getting on Facebook and countering the Facebook, memes, etc. Are there ways for the government, as well as journalists, but I think in particular the government, to arm those local public health officials, and also its city councils and state senators and others who are every day engaged in these debates, and trying to come forward and need a lot of need they're it's hard work, and they're in the fray. I was struck, by the impact that Debbie Birx had by going around the country, visiting, calling out places where masks are way too low, and the impact that had by actually going and not doing it from afar and connecting to those places. That was some of the most effective engagement I saw with these discussions. And, it got places, even in South Dakota, mask wearing got above 85%, wearing a mask most or all of the time, and was a big part of the reason I think that their hospitalizations and cases fell. Do you have a sense of how those folks can be helped to be more effective?
Yeah, I think you pointed out a really good example, because, when it became clear at the White House that they had pivoted away from focusing on the outbreak and became more interested in political issues like re-election, that Deb made the decision that she was going to just go out and spend most of her time out in the field visiting people, doing exactly what you said. Yeah, I think we can do more of that. I've actually done it, but I'm only one person. I get on the phone every other week with health officials from New York, from New Orleans, from Chicago, from LA, and from Seattle, doing the same kind of thing that you're suggesting. But we've got to do more than that. I'm only one person. I'm not having a real noticeable impact, but it's really very interesting to see when you support them in what they do. The idea that they're getting someone that's an official from Washington getting on the phone and talking, down in the trenches type talk with them about how to help in getting information for them. I actually find that it's more helpful for me than it may be for them, because I really get a feel for what they're going through, and then maybe I could bring it back and make what we do in our own exalted places a little bit more connected with what's going on the ground. So it's a two-way street.
Can I
Sure,
turn the
please.
question around a little
Yeah,
bit and
please.
ask Dr. Fauci, how do you think the press did in this past year? I mean, we always get to ask you the questions about how you did, or what you were able to do. I mean, what do you, and now that there's a new administration, what is the role of the press? I mean, we're going through this vaccination campaign, which is, from a journalist point of view, looks pretty chaotic, despite, an administration that is trying very hard to make it work better.
Elizabeth, I actually think that the press has done a really very good job, I must say. I'm not saying that because I have, I'm talking to journalists.
We're far away. There's nothing we can do to you from here.
Yeah, no, I really do. I mean, for the most part, they have really pushed back and not allowed a lot of that false equivalency to happen, even though it does happen when you have one person say one thing and the other person say another. We went through that with the AIDS denialism. You might remember with Peter Duesberg back then. It was Peter Duesberg says this, Tony Fauci says this. Two people who are scientists, who are you going to believe? I mean, that was really a difficult experience. But right now, I think they've done a really good job. And they've shown something over the last couple of weeks that I think really gives them a good degree of credibility. They are not hesitant to be critical or to put the feet to the fire, even of the current administration, when they think that something is not being done as well as they feel it should be. I mean, obviously, the relationship is different because we're not spouting, 2,000 untruths a day. But I think for the most part, it's been really, really quite good. The thing that I always say is the same way with any field, is that the press isn't a monolithic organization. There's the majority. When you're talking about the press, I think the press that you mentioned, the people who are really professionals and really take their job very seriously, versus the kinds of things where anything gets done with no editorializing at all. I think that's obviously a problem.
Can I jump in with, since we have the chance to ask the questions here, we'll add another one. One of the things I've been thrilled to see that's changed in the pandemic is the speed of science communication, the creation of preprints, basically the disappearance of most embargo systems. I think those are actually good things. But what I find disturbing, especially as vaccines and therapeutics come out, has been the science by press release, which is where you can't access the information to make any kind of a considered judgment, even as a scientist, let alone from the writer's side. And those releases, whether it's vaccines and therapeutics, are often coordinated with the government. So what's the reason not to make them put their information out in preprint as if it's going into a journal before, a Johnson & Johnson puts out, results? For example, I'm dying to see Johnson & Johnson put out in the vaccine press release results about their 49-day findings. But they were never ones that they're still not come into print. They didn't turn up in the FDA briefing guide, but it suggested that after 49 days, the effectiveness is extremely high. You may well have seen some of that data privately. How can we get more access to that information rather than have it, serving shareholder price concerns?
That's a great question, Atul. And I think there are two aspects of it that I'm going to try and condense pretty quickly, because we could have a long conversation about this, and we want to give it the amount of time that it doesn't overdo it. First of all, when the preprint service came out, the first thing I thought is, oh my goodness, there's going to be a whole bunch of junk out there. Well, I was wrong, because most of those ultimately, when you get put into a peer-reviewed journal, it may be tweaked a little, maybe a little bit, calming down of what the claim is, or getting an extra control in, or what have you. But for the most part, it's really been very, very valuable. I mean, particularly now, the work that's coming out on the variants, it's very helpful in our policy. In New York, David Hogue came out yesterday with something about the work that he did on the variants of the P1 in Brazil. It was very helpful in the discussions I had in the White House today. If I didn't have that, I wouldn't have done it. And I'm sure when it comes out in a peer-reviewed journal, it's not going to be substantially different. So that's the first point you made. The second point you make is really interesting, and it has to do a lot when the Data and Safety Monitoring Board says we've got to end the study, because then what they need to do is that they need to let the people in the control group know that the study is done. You got to let the investigators know. And what has happened when you do that is that everybody starts asking, well, why did you make that decision? So the company says, well, we've got to show you some of the data. So they show the data by press release. We get involved, the government, because most of the time we sponsored the study. And I can tell you personally, I'm very uncomfortable about talking about things that haven't been peer reviewed. But it's almost an ethical consideration that if you are going to stop a study, you've got to tell the investigators, and you've got to tell the people in the control group, and you've got to explain to them why. And once you do that, it's a little bit of a slippery slope of you're going to tell them that their data that's not peer reviewed. So maybe we can figure out some way that when they're getting ready to do that, I mean, you and I have written parts of paper overnight. I know I have, you have. Why not see if we can do that and make it in a preprint situation? Your point is very well taken, because it adds a degree of skepticism on the part of the public when you have data coming out in a press release.
And when you
add-
can't look at the tables themselves to understand, the methods and things. So it would be great to push that along.
Right.
Sorry.
A quick follow-up to that, Dr. Fauci, you mentioned you used that information today at the White House. Can you tell us what the context of it was?
No, we were talking about what kind of an approach we need to take to variants. It became very clear the point that David was making was that when you diminish the effect of vaccine-induced antibodies a couple of fold, if you have a vaccine-induced antibodies that's tenfold over where you really is the cutoff point, when you come down 2 or 3-fold, you still have protection from the vaccine. If your level of antibody is marginal and you come down 2-fold, then you're lost. You've lost protection. So knowing exactly what the impact is of the variant on what vaccines can do to protect allows you to really get a good feel of, is the vaccine going to be able to protect against that variant? And you've got to make that decision long before a paper comes out.
Libby?
Can I ask a question? It's about the vaccine rollout and about, I see and worry slightly about, politics runs by slogans and science runs by the opposite. So, first there was the 100 million doses in 100 days, which, sounds great, but it's actually not far away from where we were at that point anyway. Now I hear over and again, the slogan that really bothers me is, it's important to just get shots into arms. You hear it repeated by governors all over. And you hear it in places where, as a kind of self-justification, because the categories in many states of people who are eligible now are so broad, that to make every college kid who sometimes babysits, a caregiver, everyone with an albuterol inhaler, an asthmatic, and meanwhile, we're the ones who get the letters, heartfelt emails from like 75-year-olds with heart disease who can't get a vaccine. So what about this? What do you feel about this? The important thing is just to get shots into arms. It seems like that phrase sounds good, but it's being misused to jump the line, as it's called often in many places.
Yeah, I think that's an unintended, you make a reasonable point, Elizabeth. I think it's an unintended consequence of trying to say, to counter a bit vaccine hesitancy and say it's really important to get vaccinated. And that gets translated into, we've got to get shots in the arms of people, because the quicker you get vaccine distributed, the better off we are, particularly when you have the emergence of variants. But I could understand how that can be taken out of context.
I know we have to be conscious of your time, Dr. Fauci. We're about to lose you. So just any message that you can have to either the science journalism community or the public health community about this next phase, what we should be doing?
Well, I have to tell you, I'm not saying this to make you feel good. I said that about a minute ago, and I mean it, that I think you all are doing a really good job, and keep reporting it honestly and keep pointing out some of the things that Elizabeth just pointed out right now about some of the weaknesses of what's going on, because, people tend to self-correct. Sometimes you don't realize you're going down a path. You read it in the newspaper and you say, that's a reasonable point there. Maybe I should relook at it. So just do the same kind of honest reporting that you've done thus far. I think we are getting into the next phase. We're in a very critical phase right now because we're in a very nice deflection. It's starting to plateau. We're seeing what might happen to the danger of people pulling back. And yet at the same time, we have vaccines being rolled out. It's kind of like a war of a tug of war. Who's going to win that tug of war? And I think it needs to be reported accurately, with the data as it comes out.
Great. All right, Dr. Fauci, thank you so much for all your time and insights. It's a pleasure having you here. We'll stick with Atul and Elizabeth, but we want to let you go now to your next appointment. But thanks so much again.
Thank you. Thanks, guys.
Bye.
Okay. Atul, you had this terrific piece in the New Yorker recently where you about Minot, North Dakota, where you described the alderman who fought hard against the mask mandate, and there's just this incredible, lovely details about, going at a public meeting and saying he talked to his physician friend in Texas, and he said the best thing to do is to take a bunch of zinc and guzzle diet seltzer, not regular seltzer, but diet seltzer. So he told the citizens that, and then of course he gets COVID. And the most heartbreaking thing is, at one point he says he feels as though he might not make it out of COVID. He really gets hit hard, worries desperately about that. And then he comes back and continues to oppose the mask mandate. What do we do with people like that? You portrayed him so, I think, honestly, and you withheld judgment to kind of just paint a portrait of how this really is getting fought out in small towns around the country that are under siege. What do we do? What do you come away thinking we can do? What is possible?
A couple of things about that. Thanks for talking about that piece about Minot, North Dakota. It was partly reflecting on growing up in a town in rural Ohio that's not very different from Minot, North Dakota, where people I know and grow up with and am friends with really have extremely different political views or even a take on what's happening in this pandemic. We all are listening to different sources of information. And what I came away with was, Tom Ross, that alderman, for example, he is a lot like a lot of people I grew up with in terms of just who he is. I liked him. I think he's a good man. And more to the point, I wanted people to understand and respect that these were not people who have been oblivious to the losses. He knew the first person who died of COVID in Minot. It was a friend of his. He got COVID and watched his own oxygen level drop to below 85% in his basement and feared for his own life and didn't want his mother to get sick, right? Stayed away from her. But at the same time, he was speaking to real suffering and pain as a middle-aged person with younger kids who, haven't gotten to be in school, have had difficulties with employment, seeing people lose their jobs, and not feeling like the public health people are talking about deaths, without talking about what is the mental health cost, what is the suicide risk, what is the effects on everybody's lives, and walked away feeling that we in public health aren't speaking to that. I wanted to push back and say, wait a minute, fighting the virus is how you help get jobs back. It's, taking the foot off the pedal at this moment prolongs the agony, into the summer and into the spring. But there is some basic way in which you have both politicians exploiting those gaps and doubts and just genuine feeling that they don't believe all of the data that's out there. And, it's some of these folks like Tom is also someone who still wonders whether the election was stolen. So the place I came to, though, was I walked away heartened. It's a thin sort of sense of heartening, which is that they have had this battle in North Dakota. They ultimately voted and got in place a mask mandate. Even before the mandate, mask wearing was up to 85%, and with the mandate got to 90%. There was a slight, bump upwards, and they got their pandemic under control. It was very late in the game. They lost a lot of lives, still not as many lives as we lost in Massachusetts per capita and New York per capita, New Jersey per capita, and Connecticut per capita. There's a human element of we're late to addressing this until it's right in front of us. And they are also very humanly taking the foot off the pedal too fast. So my bottom line I came away with was, can a democracy function in a crisis like this and address it? Yes. Is it going to be too late? Are we going to take the foot off the pedal too early? Yes. And that's going to be the way that's going to go. We are not going to get to consensus, but we are going to have this battle, and out of it, humans change and evolve. My sense of how this will go is I do think we'll get this pandemic under control. The vaccination will move out. There'll be pockets that resist. We'll get hospitalizations below, I believe, under 100 deaths a day, which is about the flu levels. And we won't get it to zero. And we will then have a messy process in the next several months of, are we taking the masks off and are we still allowing it to spread? And that's going to be the way it is. It will be an unsatisfactory, but largely, I think, largely successful way forward out of it. That's what I came away with.
And I would agree with you, Atul, that it will end and it will be messy. But the question I kind of wake up with every morning as a journalist is looking at the statistics that there have been a total of 1,300 deaths in South Korea, a nation of 51 million people. That now, yes, the cat is long out of the bag. You know, we blew it at so many levels that we're stuck with this. But why as a nation don't we have, I'm not, saying we need Medicare for all, but we do need a national functioning public health system. And whether that's in parallel with, a market-based sickness care system, and we just didn't have that. I mean, my mom was one of the people who died of COVID, and she was old. She was 96. But she really, if this country had a public health system and politicians who were willing to address this early on and honestly, we wouldn't be so desperate to jump the line for vaccines. It would just be, an illness that was scary and was there in the background. But it's just shown to me this huge gaping hole in how we approach healthcare.
I'd love to pull that apart a little bit because I completely agree with you. There's one aspect that I don't think is necessarily the case, which is I think the central thing that cost us unnecessary, I think hundreds of thousands of lives, was simply having a political figure who decided in an election year that it was against his interests to speak publicly about what we know he understood to be a different, he believed some of the public health science coming his way, but that it wasn't viable politically. And when you go internationally, whether it's Bolsonaro in Brazil, whether it's in Sweden, where ironically it was the public health establishment that was driving the differences in opinion, where there was not alignment in acknowledging the reality of what people were seeing, that was deadly. That just was deadly, even with good health systems in place or bad health systems. But what made it worse here was the lack of our having a health system that was a true system, which could account for people falling between the gaps, meant that we continued to have places where there isn't deployment of testing, where there isn't deployment of vaccines, where the therapeutics weren't getting to, where basic missing elements like an adequate supply of masks and an adequate supply of ventilators. This is a system where a third of our counties don't have an obstetrician, and even more don't have an inpatient psychiatric bed access. We can't even map and name that, let alone solve it, because we're not committed to it. It's no surprise that given an infection that's a lot easier to deploy than making sure that childbirth works, that we couldn't get this working for all of our citizens and continue to be unable to, while Israel and the UK US is in the top 5 for deployment of vaccines, but we still have, UK and Israel have got 90+% coverage of their over 75-year-olds. It's 97% coverage in the UK. I mean, we're at about 70%. I'm not sure we'll ever get to 95% coverage in our population, even with Medicare because we don't have that system you're talking about.
Yeah, and our deployment is on the top 5, but it's messy. It's so messy.
Yeah.
One of my editors said to me, "How come ARP knows when I turn 65, but our government can't figure out, that it's my turn to get a vaccine?" And I've been perpetually shocked as a journalist about the lack, especially given that we spend $8 billion doing digital medical records. How, I see people get vaccines and they hold up these cards and they say, "Oh, it's in my Epic chart." Well, that's even siloed in your hospital. Why don't we have a national response to this? Why doesn't the CDC have a portal where every vaccine that's given gets registered? We don't even know who's getting vaccines now very well.
We're running out of time here, but I just want to get through a couple of quick questions that have come in. One is, as you both know, the CDC used to be around the world the gold standard. People from other countries would turn to the CDC for guidance in something like this. How irreparably harmed was the reputation of the CDC during the pandemic under the Trump administration, and how do we get that back? Just quickly, if you have thoughts, Atul.
I'll take it. I'll be real quick. I think it was severely damaged. I don't think irreparably. It will take some time. I think Rochelle Walensky is doing a great job of being a consistent voice. The test will be where she has to push back on the president, and there will be times when she will have to, and that the staff are no longer, they're no longer being muzzled and are able to respond. The second part about the CDC was they failed at testing. That was egg on the CDC face, and I do think that there's a sense of bureaucracy and a slowness of response at times that has to be changed and accelerated. I know that'll be something that that Rochelle, who is a friend and from the Mass General system, will be taking on. But it's going to take supplying consistent, honest information, and then moving fast and moving accurately. And I think there are still issues. The school an opening responses, the guidelines there are still not supporting the ability to get the schools open when 96% of districts wouldn't qualify to meet the guidelines for opening.
Okay. And just quickly, Atul, you, as I alluded to in your introduction, among your many hats, you've been with mass vaccination sites. What have you learned from that you wouldn't have known otherwise, either as a clinician or as a journalist?
To try to do in 30 seconds. So I helped stand up, and I'm doing this without taking income myself, I should point out, but a company called CIC Health to enable vaccination in Gillette Stadium, Fenway Park, and at Reggie Lewis Track and Field in Roxbury, Massachusetts, and which is a majority minority population. And I'd say the thing that I've learned that we're now demonstrating, I feel, this week, is that speed and size has been thought to be the opposite of achieving equity. And there's no reason you can't do equity at mass scale, but it takes really being thoughtful. And we're doing things like reserving 50% of the slots for local people, and deploying in 9 different languages, and not requiring signing up online in the internet to get a place in the line. So there's a lot of things you have to do that we're still learning how to deliver on.
Great. Well, I thank you both so much for all your great insights and participation today. On behalf of Ron and the entire Brandeis team, we're really grateful for you and all of you who joined us, and we'll be in touch soon. Thanks again, everyone. Stay safe.
Thank you.
Thank you, everybody.